We're now going to move to talk to Dr. Sara Bode. Last week we talked about how important it is for individuals to continue to receive necessary and needed medical care despite the pandemic. And there's been a concern raised about people neglecting their health, not catching up with what they should be doing during this period of time. What we've seen is there's been a significant reduction in the number of well-child visits for Ohio's children over the past few months. It's more important than ever to keep these appointments and to ensure kids that get their preventive care. So Dr. Bode, who is a primary care pediatrician and the medical director of Nationwide Children's Hospital's Care Connection School-Based Health and Mobile Clinics. Thank you, Doctor, for being with us. That's a long title, Doctor. I almost didn't get through that, but thank you very, very much for taking care of children. And maybe you could just kind of tell us what you're seeing out there as far as with the public, people bringing their kids in, and what you would like to see.
Absolutely. Thank you, Governor DeWine, for inviting me to speak today about the topic of pediatric vaccines. What we know, as you mentioned, is that during this time of COVID-19, we've seen a very sharp decline since March in the number of kids that have come in for vaccinations across the state. In Ohio, the rates have been down about 45% from what they typically see this time in previous years. And we've seen that same trend locally across our Nationwide Children's Primary Care Network, which includes over 15 clinical sites that care for vulnerable children in Franklin County. We've had a drop of over 8,000 vaccines per month over the months of March and in April. Additionally, when we think about the measles vaccine, we typically vaccinate over 1,000 children a month with that particular vaccine. And in the month of April, as an example, that number was 32. Why does this concern us? Vaccines are critical to prevent disease and outbreaks. We know this through recent outbreaks of measles, mumps, and chickenpox. Those are reminders at how important this is for children. And what we want you to know is that pediatric offices are open and they're safe. Offices have worked hard under the pandemic to open in a safe way and take extra precautions and measures, from wearing appropriate PPE to spacing out well-child appointments and allowing parents to feel confident when they come in that they can get their child seen for their well check and their vaccines and do that in a safe manner. But what we also know is that that's not enough. There's a large gap as new children age into needing these vaccines, and we are trying to catch up from the children that have not had them in the previous months. We need to start thinking creatively about how we're going to help catch up and close this gap. In large part to the Student Success and Wellness Funds that were focused in your budget, we've seen an increase in the number of state school health partnerships. These are exactly the kind of relationships that can allow for this creative thinking on how we can help connect children to these important checkups and vaccines. So we're working locally here, and I know in other parts of the state as well, to work with several schools alongside local health departments to really provide some additional opportunities. So we have vaccine clinics that are going to be operating all summer long, again in a safe manner for families, so that they can come and get their children caught up prior to the start of summer, end of summer, and start of school, where as children get back to school, we worry about there being a potential outbreak.
And Doctor, you talk about those clinics. Where are those available? I mean, where can someone find out where they are?
Yeah, absolutely. So actually within Nationwide Children's Hospital on our school health website, we have a list of locations, and we're going to be printing flyers that we'll distribute to many of our community sites. Additionally, Columbus City School District is going to be advertising those on their website as well, and we're going to be in several area schools across the county.
Great. Doctor, thank you very, very much. Thanks for what you do every day to take care of young people, and thanks for kind of giving us that warning. Those numbers, Doctor, are really kind of staggering as far as the drop. And I guess the goal is in the next few months to start picking that back up.
Yeah, we have a lot of work to do, but I think we're going to get there.
Okay, good. Thanks, Doctor. We appreciate it. Thank you very much.
Thank you.
Thank you.